Buenas tardes. Good afternoon, and welcome to our webinar this afternoon, Cultural Mental Health Services Through the Lifespan. We will be focusing on adults. Just a few housekeeping items. Make sure that you are all muted. If you're having any issues while you're online with us, please use the chat feature to let us know so that we can troubleshoot. And if you have any questions through the presentation, please use the Q&A button at the bottom of your screens. So the Progreso Latino Fund is an endowment fund that was created in 2003 to promote the educational and social economic well-being of Latinos in New Haven and the region. PLF carries out its mission and creates change through forums like this, celebrating Latino leaders, providing grants to programs and services that advance the Latine community, and focusing on youth and young leaders. This year, we'll be celebrating our 20th anniversary and focusing our efforts, among many other things I just mentioned, on growing Latine philanthropy. We are awarding about $100,000 in the next 2 years to issues impacting Latines today. In order to grow the fund and continue to build capacity to provide these kinds of grants, the Progreso Latino Fund is offering 2 opportunities. One is a match campaign where all donations made to the Progreso Latino Fund will be matched dollar for dollar up to $2,000. And we're also looking to establish 40 designated or donor advised Latine funds by November 2023. Each fund that's established will receive $2,000 in charitable dollars from the Community Foundation in order to support that. Joining us this afternoon is Francis Padilla, who will be moderating our conversation. We will also be joined by panelists Vikiana and Dr. Andrea Mendiola. Unfortunately, Myrta Soto is not able to join us this afternoon. I will turn the show over to Francis Padilla, who will introduce our panelist. Thank you and enjoy the program.
Good afternoon, everyone. I'm delighted to be here with you today and really looking forward to a dynamic conversation with Vikiana and with Andrea Mendiola. I want to start by acknowledging the title of this program today, Cultural Mental Health Services Through the Lifespan. And we know that we are whole human beings of mind, spirit, and body from the day we are born till the day that we age and hopefully get to age and die. And so the Progreso Latino Fund has really taken on an examination of the issues that really come into play in cultural mental health. And today, as Daddy mentioned, we will focus on adulthood. We will hear from Vikiana and Andrea Mendiola, who will bring their insights and experience to help us all understand what this means. To set the stage, I am going to start with an excerpt from the National Alliance on Mental Illness website about the diversity of the Latine community. Since we are really focusing on culture, I think it's very, very important to start with an acknowledgement of that diversity. And so bear with me, I will read very quickly. The Hispanic/Latinx community in the US is very diverse, including people from many different nations and regions of the world. Individuals of Mexican, Puerto Rican, Cuban, Central American, and South American descent have been part of the American cultural tapestry for centuries. As with any community, the mental health needs and experiences of Latine people vary among subgroups. While there is great diversity within this community, there are some shared cultural factors that connect people regardless of ancestry or national origin. For some, their indigenous roots are a source of pride. A large portion of this community speaks Spanish. There is also a shared connection of religious affiliations, strong family bonds, connections to extended networks, and a resilient approach to life and to work. Another common value in this community is familismo, a cultural foundation that emphasizes connectedness and a strong attachment and duty to one's family. So with that backdrop, I'd like to invite Vikiana Gray to join us here in the conversation. Vikiana is a clinician, a mental health clinician at the West Haven Mental Health Clinic. And she's going to speak with us for about 5 minutes about destigmatizing Latino mental health. Vikiana, can you unmute yourself and show your image? Thank you. Welcome, Vikiana.
Thank you so much. I'd like to take a moment to actually thank you, Francis, Carmen, Tara, Yadi, Andrea, and the Progreso Latino Fund for giving me and people who look and sound and have a similar background to me a platform to deliver important messages like this to my community. My name is Vikiana. I am a first-generation Cuban-American bilingual psychotherapist working in community mental health, specifically with young adults in the greater New Haven area. I have experience working with folks across the lifespan. My career has been dedicated to working with the Latinx community and all the important nuances that entails. I wanted to kick off the conversation today with a general overview of mental health and some statistics because it's important to have context and understanding of what mental health means for the Latinx community and how we access help. So let's get into it. Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps determine how we handle stress, relate to other people, make healthy decisions. I've noticed that as a community, we often think about mental health in a negative way. What I mean is that we often assume that our mental health consists of having a problem or not. I like to encourage us to think about it in a way that promotes understanding of mental health as an important part of our overall health and a component of our physical health. And much like our physical part of our health, it's something we all have and need to work on consistently. Sometimes our health will be better than other times. And just like our physical health, we will have to make changes, adapt, and seek help as needed to heal our bodies as well as our minds and our soul. So today I want to talk about mental illness and challenges, but I also want to promote the idea that mental health is a muscle that we're building every day. To truly understand the mental health concerns in the US, I turned to NAMI, or the National Alliance of Mental Health. They reported 21%, or 1 in every 5 US adults, suffer from mental illness in 2020. The prevalence of mental illness in the Latinx community within the US was 18.4%. Looking through New Haven data, we see similar information. It was noted that 12% of Connecticut adults reported that they felt down, depressed, hopeless for more than half of the days during the past 2 weeks. It also reported that the Latinx population was 2.3 times more likely to feel down or depressed when compared to white adults in this very area. Some of the mental health conditions that individuals might seek help for are depression, anxiety, substance abuse, developmental or cognitive issues, and more severe mental health concerns, including schizophrenia and bipolar disorder. One particular diagnosis that I would like to call attention to today, due to its prevalence in my work with Latinos, is trauma. Trauma is the lasting emotional response that often results from living through a distressing event. Experiencing a traumatic event can harm a person's sense of safety, sense of self, ability to regulate their emotions, and navigate relationships, which Francis mentioned was a really important part of the Latinx community. Long after the traumatic event occurs, people with trauma can often feel shame, helplessness, powerlessness, and fear. This is particularly important for the Latinx community because we often carry the trauma of our lived experience, but that of our ancestors and family, something we call intergenerational trauma. This not only affects the individual, but the family dynamic. And as family is a central part of the Latinx community, being aware of how trauma impacts us and our relationships, seeking support and making meaning can be a powerful and positive effect on individuals and the family unit. So mental health is important. Why don't we get out there and do it? The annual rate of Latinx community in the US seeking treatment is 35.1%, compared to that of white identifying population, which is 51.8%. There's several barriers that exist for the Latinx community in accessing help. First and foremost, stigma amongst our own community. I grew up hearing, la terapia es solo para los locos y para los gringos, or los platos sucios se lavan en casa. Secrecy isolates and makes situations worse. NAMI actually reported that the average time it takes people to seek out treatment from the onset of symptoms is 11 years. And to be honest, it's not surprising in my work and even in my personal life. Language barriers and having providers that might not understand the unique culture and ways in which mental health manifests in Latinos. There's usually an emphasis in Latinos of more physical health symptoms related to mental health. They're more likely to seek physical health care than mental health care. Poverty and less access to health care and insurance is part of the issue, and also immigration status, because a lot of folks feel like they have a false narrative around what mental health care means and what it would look like for even their legal issues or work status, right? Finally, I leave you with one more statistic. The US Census reported that Latinx community comprises 18.9% of the total US population in 2020. We are projected to comprise nearly 25% of the United States population by 2050. We are and have always been the future. Let's act like it. Let's take up more room. Let's talk about mental health, and let's get better together.
Thank you, Vikiana. Thank you very much for setting that stage for us. I'd like to invite Dr. Andrea Mendiola, who is at the Connecticut Mental Health Center and La Clínica Hispana, the Hispanic clinic. Welcome, bienvenida, Adriana.
Andrea.
Perdóname, Andrea.
No worries. Thank you so much, Francis. And thank you, PLF, for the invitation. I'm honored to be here in this webinar. And I'm happy to answer any questions that we're going to be getting in the chat. As Francis said, my name is Andrea Mendiola. I'm a psychiatrist. I've been working with Latinos maybe during the last 8 years. And I'm happy to have that opportunity. My main focus is on adults. And I had the pleasure of working with Vikiana. And thank you, Vikiana, for making those points very important about the Latino community. I wanted to share a little bit to open up the conversation about how, from the mental health point of treatment, we can see Latinos and how it's different and why it's different. We have to be aware that we all, and not only Latinos, but every person expresses their illness or their suffering in different ways. And it's very important to know how Latinos tend, and I don't want to generalize, but tend to express illness, in particular mental illness, right? It's very difficult sometimes to say, I'm depressed, or I'm hearing voices, or I don't feel right. And sometimes mental illness in Latinos mainly comes as body aches or headaches or problems with the appetite or gastrointestinal issues, or maybe just like a discomfort or any other ways that can be confusing. But it's very important to understand that these are ways of expressing illness. So sometimes for us as doctors, we get patients with, expressing symptoms maybe like headaches and discomfort or just not being themselves, and having that sensitivity or being attuned to those needs is very important when treating Latinos. Because we have to be aware, as Vikiana said, there is so much stigma that it's easier to say, my stomach hurts and I can't sleep, rather than saying like, I'm depressed and I'm struggling. So we have to work on creating an environment where people can feel safe to expressing these things. And that doesn't come only, from the clinic here, it comes from the community. And working, educating in spaces like these where we all can learn more about mental health helps decrease that stigma. Because we are aware that for someone who is struggling, from going to the point of recognizing they're struggling to getting treatment, there's so many steps they have to go through and so many barriers that they have to deal with. It's not only identifying that there might be something wrong or they need some help, but it's also deciding to seek help, right? And in the Latino community, we know that sometimes getting professional mental health, even though it's needed, is sometimes the last option for so many people, right? They prefer going to the church or the community, or maybe a healer or curandero, or someone who is part of their community, because, and it's understandable, it's someone that is trusted and is known by others, right? We know that mental health institutions have a bad reputation in general, and that's something that we are trying to repair. But we know that that can create a barrier for someone to get professional mental health. And then when finally someone can decide, okay, maybe I need help, maybe I go see a therapist, maybe I'll go see with a doctor, then how they can access healthcare, right? And that, I feel like that's a huge barrier between leaving the house, for example, just transportation, the kids, where is childcare? How are they gonna pay for the appointment or the medications that are prescribed? Not all places can provide free or appointments or visits or medications. So there's so many barriers that they're gonna encounter, and we have to be aware of that. And then when someone finally receives care, there is the Latino population. It has been studied that the dropouts or the dropout rate is higher than in other communities, except the Black community. But Black and Brown communities tend to drop out care easier, faster than the white community. And why is that? I mean, sometimes the Latino patient, they don't see identified or understood by their doctors or their therapists, right? They come for something, and then sometimes the cultural differences can make it difficult to understand each other. So that's why we have to be aware of these things that are so important for someone to get help and continue in care. It's not just a matter of seeing someone and then that's it. Unfortunately, mental illness usually tends to be chronic, and people tend to need care for a longer time. So we need to be aware of that. And one last point that I want to make is that I talked a little bit earlier about that. This is stigma. As I said, stigma is something that needs to be worked in every layer that we have. Not because there is stigma from the individual, from the person, maybe thinking I can't seek help because what are they going to think about me? But there's also stigma in the community, and we have to be aware of it. We have to try to welcome everybody how we are. We're all different. We all have different needs. And mental illness is another illness. The problem with it is that it's not visible and it affects our behavior in different ways. So some people just tend to put it on a side or just ignore it, or even worse, tend to discriminate because of that. And we have to be aware of that. And as a community, we have to help each other. So I'm very happy that there's a space to talk about this. And I'm happy to answer any questions or to continue talking about these topics. Thank you.
Thank you so much, Andrea. Both you and Vikiana have, I'm going to ask you both to keep your video on, if you will, so that everyone can see us in this conversation. That's great. Thank you. You both have really helped to, put the four corners of this issue around the prevalence of mental illness in the Latine community, the challenges that exist for individuals, their families, to be able to access, to even acknowledge that some of what they're feeling is in fact due to their mental health, and that is really okay and necessary, right? And I think you've also both spoken to the importance of the service providers really understanding. And I think that the other piece that you've brought forward is that trauma is an underlying theme and may not always be at play, but is often at play. So I want to pursue this conversation at the start with asking you both to focus a bit more on trauma and on how you see it showing up, how you as clinicians see it showing up. And I want to say before you answer that Luz Ramos in the Q&A has made a very lovely observation that I want to bring out, and it is that there are many fine Latine professionals and other professionals at many of the clinics and the school guidance clinics in Connecticut, and particularly here in the greater New Haven area. And it is a labor of love that I want to acknowledge, and that sometimes I'm sure you as professionals feel like you need a whole army more of folks to work with you. And so we'll come back to the professionals. Let's talk first about the community. And if you could say some more about trauma, lasting emotional response from a traumatic event or events. I think I picked up from you, Vikiana. You also noted intergenerational trauma and its lasting legacy. So let me leave that for you to explore further, both of you.
I guess I could start because I brought it up, right? I think it's important to know, I think sometimes we say, esa trauma, or like, estoy traumatic, like, como like we use word trauma very vaguely sometimes. And I think that in the mental health world, it's something that we should be more specific around, right? Because it has a lasting emotional response, and it's a very distressing event. And some of the examples of some things that could be potentially traumatic to a person, specific to the Latinx community, right, is these immigration patterns that we have, how they got to this country, what it was like to, when you finally get here and you're promised this American dream, and you face systemic racism and all the other things that come with that travel here, right? So there's that unique to immigrant families and Latinx families particularly. But there's physical, emotional abuse that has been passed down generationally, and patterns of behaviors that people have experienced themselves, and they learn as part of their worldview, as this is kind of normative kind of behavior. Like if you love someone.
Vikiana froze. Let's give her a second. Andrea, maybe you can pick up and she can pick up.
This is how you treat generations able to do the work. Then the other generations are able to benefit from it, right? And so one of the things, can you all hear me?
We can hear you now. You froze for a few seconds. Keep going, and then I'd like you to, like, how does intergenerational trauma actually show up?
Right. So in my work, particularly, I see it like, so I started off my career in working with children, right? That was my primary work, and I had become interested in actually adult mental health through my work with children, because what I started to notice is part of trauma work, especially with children, is engagement of the family, which was really difficult for families, because I think although we have culturally like this identity of like family unit and all that stuff. When it came to mental health and the stigma around mental health, it was kind of like, my child has a problem and I just want you to fix it, right? And they came there because it had become such an issue that they needed outside help, but that's also uncomfortable because traditionally we like to deal with things inside. So one of the things that you start to do in trauma work with children and their family is to start giving education around trauma. And so what I started to notice is a lot of the parents that I spoke to really had a tough time understanding the experiences of their children because they themselves were reacting to situations that they had experienced as young children and their families had experienced as young children. And it was so nice to see them building those connections, right? Because they were able to help themselves and maybe even seek treatment for themselves, and also help their child through such a difficult time, which is what all families and parents want to do, right? And so that's where I kind of first discovered well, I always knew intergenerational trauma existed, you know, for personal reasons and just being a Latinx woman myself. But that was my first introduction as a mental health provider, right? And it really made me curious as to how can I help more folks? And that's where my work started to pivot into adult work, in which I saw a need to intervene in adult work so that the work of the children could happen. Because really, if you're not able to access help yourself, it's hard. It's kind of like putting the mask on when you're in the airplane, right? You got to put yours on first. And so these parents weren't able to access that.
Was interesting, you know, if you think about the importance of our families in our communities and how we will do anything for our children. Like, as we think about what are ways in which we can build knowledge, acknowledgement, understanding, and acceptance of how important it is to deal with our own mental health as a means of actually helping our children grow up healthier, that can be a very powerful motivator. Andrea, what do you think? What's your experience?
Yeah, I think those are such important points, Vikiana. Thank you for sharing that. And as you said, sometimes, unfortunately, what we see is that people come looking for help not when it's too late, but when the problem has gotten very big and it's affecting them in different ways. And not only them, but also the family. So we see a lot of untreated trauma. And sometimes some people, they never seek help because of stigma. Some people even don't know that actually trauma can affect mental health, right? Like there is so much that Latinos suffer that sometimes like, well, you know, just put this on a side. We have to work so much. We have to pay the rent. We have to do all this. Who has time for, I don't know, going to therapy or doing something? And we just let it go until it becomes a big problem. And sometimes some of my patients come, for example, from the emergency room because the trauma is so big that they, for example, experience hearing the voice of the people who committed the trauma to them or who attacked them. And if somebody is not aware of like how the trauma can be so intense in Latinos, they can even confuse it with schizophrenia or some psychosis. And we get sometimes, unfortunately, some patients that they get prescribed antipsychotics when the problem is not psychosis. The problem is the trauma is so intense that it's just as a voice in their head reminding them of what was so traumatic to them. So it's very important to be aware of the cultural factors that can be taking place in everybody's lives, and that, yeah, I mean, sometimes I'm surprised by, sometimes my colleagues are like, wow, like these people have had this trauma like 30 years. How they have been living all this time? And there's so much resilience in the Latino community that sometimes it's impressive how like 30 years of suffering, they're able to put it to a side and go through life and bring a family up and raise kids and do everything. And sometimes we're all humans, that collapses, right? We as doctors sometimes are used to seeing patients that there's a traumatic event and maybe, I don't know, 3 months later they seek help, right? The presentation is very different to somebody who has been dealing with this for many years.
Absolutely. There's so much to unpack in what you have just shared, because one of the parts of it that jumps out at me is when someone goes to an emergency room and they present with their trauma, but the emergency room physicians are, misdiagnose them, and how that can set a person off on a trajectory that is just not the right course for them. Drugs medications that are prescribed that are not what they need. And so, these stories, they get around in the community, right? Because they do get around. What is it? There's if you have a bad experience, you tell 7 people, but if you have a good experience, you just tell one. I read that someplace once. The thing about it, though, is how do professionals, not only mental health professionals, but other parts of the delivery of care team, whether it's the primary care doctor or the emergency room doctor or the resident. In New Haven, we have an academic medical center. So when you go to the emergency room, you're going to be seen by a resident. How are those folks being educated to be confident in understanding and deciphering to make the right conclusion?
Yes, I think, Francis, that's a very big point, a good point. And there is a lot of work to do. There is a lot of work to do about that. There needs to be more education in cultural psychiatry or cultural mental health to everybody, and not only, not only to other specialties among us in mental health. There is a lot to learn and to be aware. I know there are some efforts to increase that nowadays with different communities, in particular the Latino community, since it's the minority group that is growing the fastest in this country. So there are some efforts to provide more education and awareness about mental health in Latinos, which is great, but there's a lot of work to do around that. Mm-hmm. And also, as you're saying, to work with the community to repair this relationship that has been broken for so many years.
Because it's really about trust, right? It is about trust, and being able to engage and build trust and sustain that trust is so critical. Mm-hmm. Vikiana, your thoughts about this?
Yeah, one of the things I wanted to mention is I think part of this is how do we get more people from our community providing these services, right? Because I think that's only one part of it, right? I think that we don't have enough providers. I was looking at a UCLA kind of paper, and one of the things they mentioned that Latinos are comprise 18.1% of the population, but the population of medical students who identify as Latinx are like it's in the 2s, right? And one of the things which I wasn't able to confirm about the general kind of availability of providers who are Spanish speaking or identify culturally with this population is in the 6% nationwide. And so there's a definite lack of access to people who look and sound like you, which to me is very important part of the care, right? And we could teach other folks to do the work, but also how do we encourage the natural resources that we have within our community to promote not only understanding, but careers in this path, right? Mm-hmm. And other people who can do what you're saying, Francis, kind of send the message, because we are a community of messages, right? Like we're here, mental health matters, this is important careers, these are important conversations. And so that kind of work.
The education is at multiple levels, right? That this is a field of work that needs people from the Latinx communities to be interested in pursuing, and that this is an area of our health that we all should consider just as important as the physical. And I wanted to drill down a little bit on a couple of things before going to another topic. You both mentioned the physical manifestations of mental health conditions. And some people do present, right, with headaches and body aches and malestar, right? I remember my mother used to always say that, tengo un malestar, right? And the ways that, but we also know, right, that that trauma the body keeps score is the title of an important body of work book, that also mental health and trauma that is kept inside of us and not attended to can contribute to diabetes, to asthma. It can contribute to cancer. So it's like a circle, a very vicious circle. How do people present? How can that also be part of the educational story and narrative and the education of providers?
I can start since I brought that up at the beginning. And yeah, that's a huge topic where, as I said, it's sometimes easier to describe pain or issues as physical rather than a mental or an emotional problem. It's just, it's better accepted and it's just easier to share. So that can be a problem because some people can, get misdiagnosed and get some medical treatment and get something for the headaches. And if we don't take the time and explore more, it's sometimes hard for others to share or to volunteer that information if not being asked, right? And even more in a system where sometimes medical appointments are, difficult to get, and it feels like in a rush, and the cultural part that Mendiola mentioned in one of the questions, that sometimes people get to appointments and they don't feel welcome or they don't feel understood because of the cultural components or cultural differences. So then we have to take the time and try to explore what else can be going on besides this headache that this person has been complaining for so long. And of course, there's a way of doing things, right? Like, we cannot dismiss the medical symptoms because, yeah, maybe something medical can be going on as well. So it's a matter of exploring both sides, because as you said, we as persons, we need an holistic approach, right? Like, we're not only full of physical symptoms or emotional symptoms, both things can go together and we need to address it in that way.
Mm-hmm. Yeah, I think the things that folks are dealing with are then compounded, right, by all the other stressors of daily living. And, if you are having trouble accessing care because you can't get an appointment at a time that works with your work schedule, if you can't get transportation or childcare, all these things that are also part of, or even like during the pandemic, when everybody thought going to telehealth was so terrific, that can be really difficult if you're living in a very tight circumstance with a lot of other people who can have the privacy. So I think that there are some questions in the Q&A, and thank you very much for folks that are contributing to the Q&A. I encourage even more that there are barriers to care and these social determinants of health as folks in the public health community describe it, right? Substandard housing, difficulty accessing linguistically competent care, all these things connect to even making it more difficult. And so, the question, I'm making more of an observation because I think the problem becomes more and more complex. We need to break it down to its essential core. What do you think are the essential cores? If you think about where we are today and where we want to be in a few years in our community of Greater New Haven and New Haven in particular, what are the 2 or 3 things that you think would really make a big difference?
I can start. I think a little bit of is stuff that we already touched upon. Like, there's a lot of stigma in the community that really makes it challenging for folks to get information or even start the process of talking to themselves and even their families about it. So I think that's like the first step. Like, how do we, I think in the initial stages of the Hispanic clinic, one of the things that the old director, co-director used to mention is that they used to do like going out to the community, talking about mental health, kind of speaking to what the need was, seeing what was going on, getting a pulse on that community, right? And then also, how do we collaborate with the community and understand what's going on? Because a lot of people want to feel heard, right? So that's first and foremost. And then I think we need to, as our population grows, right, we need to demand services, right, and funding for services, and take up space and room, right? And I think that's a big thing, because a lot of one thing I didn't mention is that, well, I think I did, the insurance issue, right? So like a lot of times Latinos don't have access to health care and health insurance, right? And how does that make it challenging to then access care, right? And so they're in these emergency situations, like Andrea said, that symptoms have to get to a certain extent where they even go out to get services. Part of that is the attitude towards mental health, but part of that is the lack of access of means. Like there's people who get really sick, both physically and emotionally, because they can't afford the care out there, right? And the Hispanic clinic does a good job of providing these services, but they can't be it, right?
Mm-hmm.
And we're in New Haven, right? But the state in general, right? What is the access to services, yes, right? And so those would be kind of the two things that I would really lean on, to kind of bring these services to the community and make them feel welcome. I can't say enough good things about how having a bilingual, bicultural staff has been for, in my experience with my clients while I was in the Hispanic clinic. That was amazing. How do we duplicate systems that we know work already, right? Mm-hmm. I don't know if Andrea has more thoughts.
Go ahead, Andrea.
I think you covered everything, Vikiana. What I would like to see, maybe more spaces like this for education, and education for the community in ways that are relatable, right? And that the community can start trusting more and learning more about mental health. I would like to see more of that. The work needs, I think you said it, Franz, or maybe or it was Yadi, like we need a village, right? Like it's not like some people, it's a big effort to create a healthier Latino community, with good access to mental health. And yeah, access is a big problem, especially for someone who doesn't speak the language or has problems with insurance, or if they don't have insurance. As Vikiana said, the Hispanic clinic here, we see patients without insurance and without any cost for the patient. But I mean, we can't provide services for the entire state, right? I mean, there is a limit, and the limit is also set by funding and by number of mental health professionals, right? It's so hard to find mental health professionals, every discipline. Like it's hard to find psychiatrists who speak Spanish, or bicultural social workers. Finding a nurse is a challenge here. We're still looking for nurses who speak Spanish here. It's a challenge to find mental health professionals who are bicultural and bilingual. So increasing that and increasing the funding, or advocating more for this and changes in policies can help also provide better services.
Well, I think you've both really, in answering my question, zeroed in on the importance of public policy and the importance of that being both at the local level and at the state level, certainly at the federal level. There, is there's a campaign that you may or may not be aware of in Connecticut, led by an immigrant coalition and their allies, called Husky for Immigrants. And the purpose of this campaign is to have the Husky program opened up to all immigrants, regardless of immigration status. And it has been working for this is the third year of this campaign, and it has been able to achieve the expansion of Husky for children up to age 12. Hopefully this year it will go to age 18, but they have been working on getting it for everybody. And it's that the legislature is moving at very incremental paces because, you know, they don't want, they say there's not enough money. They say they don't want to make Connecticut a state that is going to attract people to come. It's all the same narrative that we hear at the national level, right? But these barriers to care are real. There's also legislation this year under consideration for increasing the reimbursement rates under Medicaid. And I'm aware, right, that not all Latinx people are eligible for Medicaid, but a lot of people are, and that is the public program. And I think you may agree, I'm not sure if you know this, but reimbursement for mental health services is better under the Medicaid program in Connecticut than it is under commercial insurance. Commercial insurance is much stingier. And so having reimbursement rates that make it that easier for more professionals to accept Medicaid might open up a pathway, right? And then there's a bill as well that is focused on children's mental health, but is also, it's Senate Bill 2, and I forget exactly what they call it, but the idea there in that bill is to expand services for Spanish-speaking members of the community statewide. And these are things that the legislature needs to hear. For the Husky for Immigrants bill, like 280 people showed up at the Capitol in February to give testimony. And they gave testimony in Spanish and had people do simultaneous translation. It was very inspiring, but our leaders need to hear. They need to hear. And the professionals actually are very, very credible messengers, right? So that's like a place where I think the professional community of Latino clinicians and other folks can get the voice heard, made the voice heard. I think, we have a question in the chat, not in the chat, in the Q&A, and I encourage folks to use only the Q&A because I can't monitor both the chat and the Q&A. But one person is asking about free mental health care for folks who have no insurance and are undocumented. And I think, Andrea, you mentioned that the Hispanic clinic rather, is a resource for folks who are Spanish speaking and do not have health insurance. Am I right about that?
Yeah, that's very right. We see patients here in the clinic. We don't ask for papers. We don't ask for insurance. We give them all the services that they need. And we even have a pharmacy that provides medications without cost for the patients. Most of the medications, of course, for mental health. And that's something that we take a lot of pride because we can serve a population that usually struggles to find services. We also see patients with Medicaid, with insurance, with not private insurance, but Medicaid or Medicare. But yes, we see patients here without insurance for no cost. So that's a resource. Unfortunately, I don't know about other places I know other places that they see patients without insurance, but I know they have a small fee to pay.
And the Hispanic clinic only sees patients that live in New Haven or outside of New Haven too?
We have a catchment area. I don't know the limits, but it's not the entire state.
And but it's more than New Haven?
Maybe Vikiana knows better. I don't remember the catchment area, sorry.
Yeah, so I didn't do intake particularly, but yeah, I had other patients in like other areas. I don't know if that was a specific exception. But we can, I think after this seminar is over, I think it would be good for us to provide more information about the Hispanic clinic. One limitation of the Hispanic clinic that we have and we've tried to work on a lot is that the patient does need to be monolingual Spanish speaking, right? We do prioritize folks who don't have insurance, and we do prioritize folks who have severe mental illness, right? Because they're unable to access services in other areas. So that is a barrier, right? Because then what happens to the folks who may still have mental health struggles? They're just as important. Trauma is important. It doesn't always manifest in the severe mental illness, but it's severe for that person. And there's people who speak both languages, right? And they would like to see a provider who understands these cultural nuances, right? But because they speak English, that's an exclusionary criteria, right? And so we depend on private practice. We other community mental health clinics that may have, like Andrea said, a sliding scale. But again, with attitudes towards mental illness and it being so stigmatized, how do people go through all these hoops to get the treatment that they need?
Yeah, there's a lot that you have to navigate as an individual, a whole lot. And these are very artificial lines, right? Because that we see them as artificial lines, and they get created because of funding requirements or funding limitations. And, again, it goes back to policy, because where we put our money is a reflection of our policy, where we want you support what you value, and as a community. We've got only a few more minutes, and I knew that this would happen, that we could probably go for 3 hours talking about this, but I want to go back to a point in the Q&A that I feel is like, what can we each do in our own circles? Because some of this is very difficult work, the work of educating and changing minds in our community about the importance of mental health care for ourselves and our families. And so one person is asking, how do we educate and empower our loved ones in our own circles? How do we do that so that, it goes back to familismo?
Yeah. Go ahead, Vikiana.
No, it's okay if you had something.
I was just gonna say, just briefly, that it's very important because familismo is important. Francis, as you mentioned, that family is important for everybody, that our family understands us. So if someone in our circle or in our family, they don't want to talk about mental illness, or they think it's not important, or they just dismiss it, I think a point, a start point can be trying to understand that person, right? Why is it that they don't want to talk about mental illness? And maybe it's because they don't know much about it, or maybe they were told not to talk about that. Or maybe they're just afraid of what they can learn from that. So given a space, and this takes time, it's not a one-time conversation, right? It has to be a long conversation of trying to understand that person and giving them the opportunity to talk and understand themselves, why it's so difficult to talk about mental illness. And that can be a good start point.
Mm-hmm, mm-hmm.
I wanted to mention something really important to me personally. It's the work starts with us. I think oftentimes it's part of our community, right? To focus on our family, focus on others, kind of drive, do a bunch of things, right? But we need to focus on ourselves and our mental health. Again, that's the idea, putting on your mask in an emergency situation before you put on somebody else's. How am I going to talk to others about my mental health if I don't have a good idea of what's going on for me internally, right? And so I want to bring that to the forefront, because I'll give you my personal experience as a child. It was, when I heard people talk about mental health, they talked about it as somebody else needing the help, right? And so what does that mean? How does that stigmatize this work even further, right? And so I think if we start talking about me, what am I doing for my mental health? How is my mental health important to me? What do I do as an individual to be better, right? Because mental health, again, I want to bring that point back. It's not about good having mental health problems or not. Everybody has mental health, right? And it's this idea that we're constantly working on it, right? And so how I talk to folks about it in my personal life is I let them know, hey, this is something important to me. This is something I do myself.
It's interesting because I wrote down when you started, Vikiana, that you said mental health is a muscle that we build every day. And, you know, some people go to the gym, some people walk in the morning, some people kneel down and pray the rosary every day. Some people, you know, whatever it is that they do to build a muscle, right? A habit, a care. And this is the point that you're making. Very, very important. I think this is a terrific way to end it here. Obviously, we have much more to discuss, but another day. And Tara, I'm going to pass it over to you to close us out. Thank you so much, Vikiana and Andrea. A pleasure to be with you today.
Agreed. And gosh, it's hard to close out a conversation that's so enriching and for which there's so much more to say. But thank you to the panelists and thank you for this really important conversation. And before we give a few announcements, I just do want to echo what Vikiana was saying at the end, which is one of the best ways that we can empower and support our community in seeking mental health treatment is to share our own stories when we're focusing on ourselves and focusing on our own wellness and health, because then it starts to destigmatize and we can welcome someone and say, hey, I'll go with you to get you started. So just a really important thing to uplift, I think. So again, thank you to the panelists. Thank you for everyone who participated today, for your questions in the chat, Francis for moderating. At the end of this session, you'll have an opportunity to complete an evaluation form, which maybe is that, I'm not sure. But please do, because we really take all of your feedback. It's actually your feedback from our last session that helped us to create this series. So we take all of your feedback seriously, and so we'd love to hear from you. So please make sure to do that. Also want to let you know that this isn't the end of the conversation. So we decided to start with adults because we find that our adults are sandwiched between taking care of children and taking care of their elders. And so we wanted to help you, as Vikiana said, put that mask on yourself first so that you can have the energy and the strength to take care of others. But we will have a few other programs that we hope you'll join us on. June 20th, we actually have a legacy planning program for you and those that you love. I mean, financial health is one of the things that impacts your mental health. It's one of the 8 domains of health. So it's one that we're trying to also bring some information to this year. So please mark your calendars for June 20th, again from 6 to 8. And then June 29th at noon, we'll have another one of these webinars, the second part in the series, where we'll be focusing on mental health in children and adolescents. That's my own personal area of expertise and interest. And then also September 28th at noon, we'll have the third part of this series in which we're going to focus on our seniors in our community. So again, thank you for joining us. Thank you for being part of this conversation in the chat and our panelist and moderator, and know that there's lots of opportunities to be engaged with PLF. Yadi shared a few of the exciting things going on. So if that interests you and you'd like to help support us in continuing to provide these kinds of programs and to grow in the ways that we support our community, I invite you to consider some of the ways that Yadi outlined in the beginning. So thank you all very much for being here. And we look out for the recording and some other resources that we'll share as follow-up to this conversation. Thank you.
Thank you all. Take care and have a great day.